Hello, I'm Congresswoman Eddie Bernice Johnson, proudly representing the 30th Congressional District of Texas. I am delighted to speak with you today to bring this week's Congressional Black Caucus's message to America. There is a dangerous and destructive undercurrent in our mental health system here in America. Many of our laws, rules, and regulations seem to prevent those with serious mental illness from getting the life-saving care they need. Worse yet, these policies disproportionately impact minority communities. Statistics reveal African Americans are 50% less likely to receive psychiatric treatment, and outpatient mental health spending for African Americans is 40% lower. Many of our state and federal policies are to blame for the shortage of psychiatric beds and lack of mental health treatment in minority and low-income communities. The majority of those in need of psychiatric treatment should be receiving care in the community settings. However, too many are left untreated, leaving these individuals with serious mental illness with nowhere to go. These men and women are cast aside, left in homeless shelters, or worse yet, locked up in a jail cell where their illness only worsens. Correctional institutions have become our modern-day asylums. The financial cost and human toll are compounded by the lack of treatment once behind bars. Between 83 and 89% of people with mental illness in jails and prisons do not receive appropriate psychiatric care. Recent estimates reveal that a number as high as 1.5 million Americans with an identifiable, diagnosable, and treatable mental illness are incarcerated, many of whom would not be in the criminal justice system had they received appropriate treatment earlier in life. Incarceration must no longer be de facto institutionalization for those with mental illness. We can keep families together by allowing the court to direct treatment in the community. We must move to alternative programs such as court-ordered assisted outpatient treatment because it has proven to reduce the rates of imprisonment and homelessness, substance abuse, and costly emergency room visits for chronically mentally ill. As the first African-American chief psychiatric nurse at the Dallas Veterans Hospital, and the first nurse ever elected to the House of Representatives, mental health reform has been something I have fought for my entire career. No one should be written off as a lost cause if they have a mental illness, regardless of their race or income. Our mental health system is in crisis, and it is failing our communities of color, and I, along with my colleagues in the Congressional Black Caucus, are working hard to create better laws and regulations to help fix this growing problem. We can do better. We must do better. Thank you very much for your time.